God. Oh my God. What is going on here?
MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming.
Well, welcome to the MedBix Webcast. 1 second. Welcome to the MedBix Webcast. You know, there's today a little bit of a technical problems. I'm solving it. They tell you everything. They tell you everything is so easy, but it's not easy. Okay, technical. You know, artificial intelligence, if it is really need to work, they need to understand the natural language of ours. Just don't oversell the artificial intelligence. The day you solve the human problems, that is the artificial intelligence makes sense to me. Okay, but I talk about a lot about artificial intelligence, pissed off a little bit because of this technical problem a little bit. Anyway, everybody has this technical frustration. We need to solve this problem, and then doctors need to raise their voices against these frustrations people go through. You know, it's very important because it is really taking a toll on health, on the teenagers, health on older people. They think that they don't know what they're doing. It is a really serious issue. They need to do this, But anyway, besides my frustration, this is Ramana Annamaraju. I'm the MedBix host of the MedBix webcast, and I have a very interesting guest. Today, I'm deviating from MDs. I'm kind of a doctor. He's a podiatric medicine. He's a Dr. Kornfeld. He's joining from Long Island. Podiatry is a foot and ankle things. I don't know much about it, to be honest with you. I'm going to ask him all the questions. So let me bring him. He has a very interesting background, and let him. I will ask him what his background is. Just let me. Hello, Dr. Kornfeld. Welcome to the MedBix Webcast.
Thank you, Ramana. Nice to be here.
Thank you. So, could you please explain a little bit about your personal and professional background, if you don't mind?
My background.
Yeah.
Well, I've been practicing podiatric medicine and surgery for 42 years. Before that, I was basically thought I was going to be a professional musician. And when that didn't really go the way I wanted it to, I decided I had to change course and wound up deciding to be a doctor. And at the time in college, I was doing a lot of running and I had injured my heel. And I went to a podiatrist and I was very impressed with the way that I was managed and handled. And I grew an interest in it. And that's kind of how I wound up doing what I'm doing. But all along, I kept up with my music because it's my passion and my joy.
So, what is a podiatry in general? Just to give a few things. I don't know much about it. Then I know they take care of the foot and ankle, but tell us a little bit more about it if you don't mind.
Well, I mean, there's many different aspects to dealing with the foot and ankle. There's the medical part of it because many diseases manifest in the foot. Of course, the one that everybody knows about is diabetes because it causes vascular and neurologic problems in the foot. And we work very hard to salvage these limbs and prevent amputation. In my field of functional medicine, we work very hard to protect the vasculature and protect the neurologic function in the foot by dealing with underlying mechanisms. So instead of waiting for the issue to occur and then managing it, we're doing a lot more in the way of prevention and trying to up-level the immune system of our patients and manage everything that we possibly can. There are a lot of other aspects to podiatric medicine, obviously, since everybody spends thousands of steps every day on their feet. And now with the fitness craze, people are running. There's a lot of, overuse injuries and stress injuries. And when there's biomechanical issues, they sort of come out a little bit more. When parts get injured, the immune system has to heal them. And that's where functional medicine comes in, because we have a situation now where the human immune system is devolving, and it's getting harder and harder for human immune systems to repair injury and replace dead cells and detoxify the body in a timely way because of the way our epigenetics are being fostered with toxins in the air, toxins in the food, all kinds of artificial ingredients. The body's not being fed naturally anymore, and it's taking its toll. And because the human foot is the furthest place from the heart, it's the least well perfused, and it suffers more chronic injuries than a lot of body parts do. So we have the medical part of it, which we manage, and we also have the surgical part. So whenever there's a surgical procedure that needs to be done on the foot and ankle, this is what our residencies, focus on. 3 years of solely foot and ankle surgery is our basic residency training now.
Besides the diabetes, and everybody knows about the diabetes and
Mhm.
everything, that is, what are the underlying conditions you see think that have functional medicine? What you just talked about underlying conditions. Just tell us a little bit besides what are the true underlying conditions. You mean
Okay.
immunity is one of them, you said.
Yeah.
So just expand on that,
Well,
if you don't
we,
mind.
we look at things that might burden the immune system. So since 75% of the immune system is in the gut, the diet plays a huge role in immune system health.
That's
So we focus a lot on the diet. Then, of course, everybody, I hope, has heard about the friendly, or what we call good bacteria in the gut. That plays a very, very huge role in the health of the immune system because it ferments complex carbohydrates into short-chain fatty acids, and short-chain fatty acids are the food for the immune system. They don't really exist in food, so we rely on the gut bacteria to help us create that. Unfortunately, because so much of the carbohydrate now being consumed is refined, simple sugars, they kind of feed the pathogens in the gut more so than they do the friendly bacteria, and they don't convert well to short-chain fatty acids. So in my line of work, we're trying to get people to understand there's a quality issue in food, not just, food sensitivities and things of that nature, which also misdirect the immune system. We also have issues with stress. One of the biggest problems in the world today is people are burdened by so many different things that stress is now taking a hold pretty much in the entire world. All you have to do is listen to the news and you get stressed out.
yeah.
So, chronic stress is a burden on the immune system. It slows down immune function. It interferes with thyroid function. It really does so many different things to get in the way of what we want to accomplish. And I do want to bring up, since a lot of people are listening, simple sugars will mimic a cortisol reaction, which is the fight, flight, and fright response to danger. So if the predator wants to consume you, the body has to respond, and it pumps out this hormone called cortisol from your adrenals. Its job is to make sure there's enough sugar in your bloodstream for rapid energy so you can defend yourself or run away. Unfortunately, when simple sugars enter the bloodstream so rapidly, the brain thinks you're in danger, and it starts to pull from some of the excitatory neurotransmitters that are designed to protect you from these, dangerous situations, and certainly from chronic dangerous situations. All of these interfere with the ability of the immune system to function efficiently. It interferes with sleep. It diminishes digestive enzymes. It has a lot of different effects on the body. So what functional medicine does is we look at all of the different systems of the body. We may analyze fatty acids. We may analyze how much oxidative stress is going on in the body. We look at, adrenal stress. We even do DNA analysis and DNA methylation testing. All of these things tell us what's going on in the body and where the burdens may lie, so we can manage those. Once they're managed and we have an unburdened immune system, or as unburdened as it can be, then we can treat symptoms by stimulating immune function rather than using drugs to suppress symptoms, which is basically what Western medicine relies a lot upon. So there's a very slow progress when we're dealing. Most of my patients are chronic pain. So it's done in steps. Nobody comes in, gets a diagnosis, and gets a treatment in the same visit. We have to look at underlying mechanisms. We have to find the reasons why that patient crossed the morbidity threshold, manage them, and then we can successfully treat symptoms. In my field of podiatry, it's twofold. It's all the things I just said, and then, of course, we have to look at biomechanics. If there's structural problems, if there's functional dysfunctional biomechanics, we've got to make sure we analyze it, diagnose it, and correct it. So it's a really interesting field. I happen to love what I do.
I'm from India. They say food as a Ayurveda is they started in India. That is what they say is food as a medicine. That you eat food as a medicine. So, do you see a direct link between the quality of food, the things you eat, and the direct of foot and ankle health? Do you see a correlation?
Absolutely, because you understand that what you eat translates into what's going on a cellular level, and what's going on in one cell is going on in every cell. So poor quality diets are a big problem in our situation, in our country, of course, probably pretty much in the world. But the most unbelievable shortfall that I find in all of my patients is they don't drink enough water. And when you don't drink enough water, you're going to have a problem detoxifying. When the body's burdened with toxins, it really can't do what it has to do. You can't flush out the toxins. All the chemical reactions in the body rely on a water environment. So people don't even know that they're dehydrated because they're not thirsty. And that's one of the hallmarks of dehydration, is not having thirst, because the body learns how to make water out of all the other substrates in your body. So I have to teach my patients how to drink water. It has to be done slowly over time, so they don't wind up spending their entire day in the bathroom urinating. But little by little, we get them well hydrated, and that makes a huge difference in the way they feel and in how their body functions. So diet and hydration are really important.
Dr. Kornfeld, what kind of patients you get in general? I have a lot of friends with NBA players. Some friends, not a lot, but some of them are good friends of mine. They always have a knee problem or the foot and ankle problem. So you say some doctors say you do exercise. That's a moderate exercise. They do quite a bit of exercise and they do use a lot of legs. So they have this problem when they grow up, when they're a little bit older. It is causing a serious problem. What is is it moderate? Well, how do you answer that thing?
Well,
Where do
obviously, as we age, so does our immune system. So what the body's able to manage when we're younger, it may not be able to manage when we get a little older. So we want to see children. We want to be able to diagnose structural and functional problems at an early age so they can be managed. But we also have to take into consideration that a less efficient immune system is going to be burdened more easily. So when there's a lot of exercise, we are liberating a lot of free radicals, which are the end products of all the metabolic and oxidative problems going on in the system. We've got to get rid of them. And if we can't, they build up in the body and they can actually start doing damage to our cells, and ultimately can cause the expression of genes of degeneration. So we want to obviously intervene on behalf of all of that. before it gets to that point. Unfortunately, peripheral vascular disease is a huge problem in our country, not just with diabetics. And it also mirrors what's going on a cardiovascular level. So, we pick up a lot of things by examining the foot that may not actually be manifesting yet in a diagnosable stage in other parts of the body.
Interesting.
Yeah.
So I didn't know. So you can diagnose with the foot that is a cardiovascular problem. Blood. That's why we do a test called PAD, the PAD, ABI index. That's what
Hmm.
we do to measure that is with the cardiovascular, the chlorosis, arthrochlorosis diffusion across the
Right.
body. That food gives the indicator for the entire body, right? That's
Absolutely. And one of the things I find because of the way that I work, when we're analyzing patients that have symptoms that relate to stress disorders, we find when we do an analysis, many of them have elevations in the excitatory neurotransmitter called epinephrine. Its job during times of danger is to make the heart beat more rapidly to push all the energy molecules through the body quicker. But epinephrine is a very potent peripheral vasoconstrictor. And it's done because the body is borrowing blood from the hands and the feet to push it more centrally into the muscles of defense or running. But it interferes on a chronic basis with normal circulation in the microscopic blood flow of the foot. That feeds nerve cells, tendon, ligament, joint, skin. It's critically important in the feet that microscopic circulation be patent. And when we manage the imbalance in the nervous system, we actually see much better blood flow in the feet. And that obviously aids healing and repair and prevents the body from going into states of chronic inflammation.
can you repair the nervous system plus vascular system? You can take medications for the vascular, but the nervous system, can you do that? Is a
There,
damage you can repair back through
well,
your immunity?
the wonderful thing about the peripheral nervous system is it can regenerate as soon as the burdens are lifted. So, in other words, if we have a patient who's in microscopic vasoconstriction, the nerve cells are not getting enough oxygen, they're not getting enough nutrients, they become dysfunctional, slowly start to die. But they can heal, they can repair once they get enough blood flow to repair themselves. It is the slowest healing cellular system in the human body, unfortunately. However, I have done hundreds, if not thousands, of patients with peripheral neuropathies that have gotten better. But you have to address what's going on a systemic level, not just on a foot and ankle level.
Dr. Cornfield, a lot of people, when they have feel leg pains or anything like that, they want to take a Tylenol, a couple of Tylenol or aspirin or something that do that. Do you have any quick recovery from that without using drugs? What do you
Well,
do?
yes. Well, let me explain why I don't think it's a good idea to mask symptoms. Number one, anti-inflammatory drugs are designed to give relief by interfering with the chronic inflammatory pathway. Chronic inflammation is a pathway of protection, and it's recruited by the immune system when the pathways of repair and regeneration are not functioning optimally. Those pathways will ultimately lead to degeneration if they're not managed. However, these drugs that we use to limit the amount of pain also interfere directly with repair and regenerative pathways as well as detoxification. And most people know when they're on these anti-inflammatory drugs, they've got to go for liver tests to make sure they're not becoming toxic because the body's having trouble clearing toxins. So same with pain relief. When you're relieved of pain, but the condition is not healed, and you walk or run on that part because you feel okay, you're doing further damage to that body part, and it can lead to more chronic injury. Same thing with cortisone injections, which are done very frequently to relieve, inflammatory pain. I recommend obviously looking at the underlying mechanisms, looking at what's causing the burden, because that's what leads to inflammation. So when we unburden the immune system and we're feeding the patient properly and we're well hydrated and we've got the nervous system balanced and we have a good balance of nutrients in the body and we've eliminated or ruled out any mutations in their DNA. And if they have them, we manage them. That's when the immune system becomes more perky and it can start to handle things a lot more easily. I also use a lot of regenerative medicine, which are injections that help the body to do what it has to do in terms of healing. And that's done locally wherever the patients are struggling to heal. We can put their own platelets back into their body. These are drawn out of the patient's blood, and we put them in areas where there's a need. They're high in growth factors, they're high in enzymes. They help the body regenerate whatever missing tissue there is, if it's a torn tendon, a torn ligament, erosions in cartilage, etc. I also use something called prolotherapy, which does the same thing, but it's not drawn out of the patient's body. Those are done in my office with combinations of anesthetics and calcium and saline. And it also fosters repair by pushing the immune system to do a better job. I'm not a fan of suppressing symptoms because it usually winds up getting people into trouble.
It's interesting that you're saying that I used to go to, I had a friend in Atlanta, Georgia. Then they used to do the toxins, take away the two toxins away. They immersed my foot into the water, and they say it is a way to drain out the toxins. So do you suggest that to create that through the water, that kind of a liquid, something that draw the toxins out of the body? Do you believe in those kind of things?
I don't know if I've seen any convincing literature on the detoxification through the feet, but certainly cleaning up the diet, managing stress, getting better sleep, all of those things help. Exercise, walking, things that actually promote healthier function in the body are what can manage detoxification long term. I don't think it's good to rely on, saunas and sweating and little patches to remove toxins and still eat a poor diet, have a lot of stress, not sleep well, don't drink water, don't exercise. We have a real bad problem, at least here in America, with obesity. And it's causing a tremendous amount of issues. We have so many lifestyle induced problems in the health of the American public. And we really have to start addressing it in a much more profound way. It starts with educating the patient. So I do spend a lot of time in the office talking to patients, teaching them, educating them, helping them to understand the dynamics of healthy living.
You're one of the exceptional doctors because you do a lot of immunotherapy, immunosystems, you're developing immunosystems. Even I see a lot of nowadays, a lot of dermatologists are talking about immunosystem to create. Now the doctors are realizing more and more even, that immune system is such a critical thing. The diet and immune system is such a interrelated, so much interrelated. So we have to really focus on, so what are the practical things I do? For example, I do intermittent fasting. I do eat only one meal a day. So
Mhm.
I wait for 16 hours a day. That really helped me because I'm lazy to cook and all those things. After I became a single, it really helped me in my laziness in that sense. So do you suggest the intermittent fasting, something like that? What
Well,
are
not
the other
specifically.
what?
I don't think there's a one diet that fits all. Everybody is unique. Everybody has genetics from ancestral diets. Everybody has different dynamics that they deal with on a daily basis. We also sometimes have to test for sensitivities to food, which are not allergies, but you may be eating a food that provokes an immune response and you develop antibodies to attack food, which is a huge misdirection of the immune system, and it creates a free radical, which can do damage in the body. So if we find food sensitivities, via a blood test, those foods are eliminated for a period of time. I've had people that I just didn't know why they weren't getting better and had them go back to a completely ancestral diet, and they seem to do much better. I've had people that all they had to do was get rid of white sugar, white flour, and white rice, and their life turned around because the refined carbs disappeared from their diet. Also, food combining. I find people have habits. When they eat the same foods frequently, that can provoke an immune response. So, rotating your diet, keeping it fresh, making sure you're not constantly eating the same thing over and over again can also help unburden the immune system. But I would say that right now, what most people need to become are qualitarians, which means eat high quality food. Try to find organic food when you can. Eliminate the white sugar, white flour, white rice. Drink enough water. Get rid of all of the dehydrating liquids like caffeine, large amounts of alcohol. All of that does, it's terrible things to the body.
Do you do, if you want to test somebody for the this kind of microbiome testing?
Mhm.
Do you do the microbiome testing for the on the
Yes.
patients?
Well, it's an important part of keeping people healthy. And that's all part of what I was talking about as far as gut health is concerned. And we look for a healthy balance of bacteria in the gut to see what's going on, and it's very revealing. Those tests are quite revealing in many different aspects. When we find imbalances in the gut and we can correct it, patients start to feel a lot better. So it is a big part of the future of medicine. It's here now, but it's not something that's typically tested for in most medical offices. But in functional medical offices, it's being done on a regular basis.
But you said that rice, in the India, Chinese, Japanese, Indians eat a lot of rice. I mean, there is a good part of it, and people are not, is if you eat a moderate, anything moderate level, that is okay, right? I eat rice. I love rice. What is your advice on that?
Well, like I said, if it's your ancestral diet, you'll probably manage to deal with it a lot better.
Correct. Yeah.
But the world has become a melting pot. It's not just the US. People everywhere all over the world are eating foods from all over the world. You come to America, you're not just eating your ancestral diet. You're eating Italian food, French food, Chinese food, Japanese food, Korean food, you name it. Everybody's piling in all kinds of foods into their body that their chromosomes have no idea what it is. And sometimes it's difficult for the body to accept it. And that's why we see a lot of these patients with multiple food sensitivities, because the system is just being torn apart by all these foreign foods. In addition, we have a gluten problem now, because way back, I guess it goes back 60, 70 years, they began engineering wheat to have much higher protein content. And that was designed to hopefully solve the world's hunger by giving them a food that contained carbohydrate and high protein, and it was inexpensive to produce. But because of the high amount of gluten, there's a lot of people that are suffering. And I'm not talking about just celiac disease, which is a complete and total intolerance of gluten. There are people that are sensitized by it and become inflamed. So gluten-free, and that's a test we do to rule out gluten sensitivity or to rule out celiac disease, because that's on the rise.
What do you think of this? The Korean and Chinese foot massage. The people go to the foot. What do you suggest is a good idea or a bad idea? Or
I think massage is fabulous.
good.
And anybody who's massaging you who has an intention to help you is going to help you. The only thing we have to watch out for is people that have pain syndromes in any part of the body. If someone doesn't really understand what's going on in that particular body part and they massage too deeply into it, obviously they can flare up the inflammatory response. But I think massage is great. It also helps to detoxify. It lymphatically drains the body. It's great, and it's very relaxing. I think it's very therapeutic. I go for foot massages.
You're very interesting. You're one of the doctors that deviated from the normal traditions of the podiatry, and then you're going really talking about good health. And as a doctor should now, this is a holistic kind of health that doctors need to profess to the patients. They are if they are true advocates. And I agree with you. Let me present a topic on some of the one of the topics I'm going to present. After that, I come back and ask you a little bit of questions about both. You can jump in anytime, and you can comment on any one of them that my slides. So I'm going to present a topic on a historical topic from a Chinese woman. I'll tell you the story of it. Just let me get you the on the side a little bit, and both of us going to be on the side. Okay. So that is a Dr. Kornfeld, Robert Kornfeld, ancestral diet. He's talking about very interesting, right? Ancestral diet. I love that idea. Is really that is interesting, concept if you think about that. Dr. Kornfield, when I come back, I'll ask you more about that. Actually, yeah. So let me talk about this woman. She was called three without a scientist. That's very interesting. What is three without a scientist? Three. She doesn't have no degree. She is not a part of the Communist Party, no Communist Party, and no research papers. And she became the Nobel Prize in Medicine and Science. That is what they call her, three without a scientist. In China, they call her. That's very funny. That's what they do. So let me talk about this a little bit about it. You talk Vietnam War. Every American know, probably Dr. Cornfield probably experienced in this area this time. Some of his friends probably went to
Oh, I sure
Vietnam.
did. I mean, I'm 70 years old. I grew up in this era. So,
And they said, you see that South Vietnam, there is a war between, as you all know, in 1955 to 1975, 20 years of war went between South Vietnam versus North Vietnam. North Vietnam is supported by China, is a communist party, and South Vietnam is a more capital freedom, free enterprise kind of thing. United States supported it. As you all know, I tell you the story, why this story is so important to our story. So, total killed in the Vietnam War is a 3.8 million people were killed. I was shocked. 60,000 Americans were killed. It's a the older generations of Americans he met, like Dr. Robert Kornfield. Some of his friends must have gone to the Vietnam War. Drafted to Vietnam War, right, Dr. Kornfield? Some of your friends, right?
some of
You,
my older friends, yes,
yeah,
definitely.
yes. So that is a Vietnam War. So at that time, China was supporting the North Vietnam. Is a Mao Zedong. Mao Zedong is the Chinese chairman of the communist. He is a founder of the Chinese Communist Party. Okay, he's a he's a he's a he was supposed to be. He studied library. He was a librarian, and he studied lawyer. He failed in all of them. Actually, he did not become anything. He became a brutal politician. I tell you about that a little bit about it. So he was a is a Mao Zedong is the Chinese chairman. He was supporting the North Vietnam against the South Vietnam, against China. That is a war between the indirect war between the China and the United States. You know, is it this Mao Zedong? I'm familiar with it a little bit. He was brutal dictator. He killed his own citizens, 40 to 80 million people. He killed them. He hated intellectuals. He sent them to labor camps. All the doctors, scientists, they all sent to labor camp. He was a he was one of the most brutal dictators of the China. He didn't have any sympathy for his own citizens. So he was one of a librarian who became a brutal dictator. In fact, very strange as you can get. So, but anyway, that he was supporting. So there was a problem. What is the problem during the war? It's yeah, he met. So sorry, I want to go back a little bit. That's I want to tell you how tricky this Chairman Mao is. He met Nixon. He met the Indian. You know that if you know the story of the Brutus, Caesar, he said that Brutus kills him, and then say you Brutus. That's a very use like a betrayal. The people use you Brutus as an expression that people use for betrayal. So actually, in India, still they think about that betrayal of China, because our Prime Minister Nehru met Mao, and he promised that everything is going to be there. We are not going to have any war, and he declared a war on India. He encroached in the northern part of India. In fact, he did the same thing with the Nixon. He was just talks nice in the front of you, and then right the moment you leave, then he goes exactly opposite he does. So he is not a reliable guy. He is a betrayal. Is a common practice for him. But so what happened during the Vietnam War? Men against the mosquitoes. Malaria is killing the North Vietnamese and Southern Vietnamese. A lot of Vietnamese are getting killed. A lot of Americans are getting killed, are dying because the malaria people are getting thousands of them getting infected with the malaria. Malaria is a mosquito-borne disease, so it is a big problem. And then Mao, Mao is almost Mao China, North Vietnam is almost losing the war with the American air power. They're taking over. So malaria is the number one enemy. What is malaria? It's a fever, it's tiredness, vomiting, headaches. Even it can cause seizures, coma, death. It can cause all of those things. If you are if you are from a tropical country, you experience malaria. I did, when I was a kid. So everybody, this is a big problem in those countries, particularly where mosquitoes are mosquito-borne disease. A parasite is a parasite driven disease. So what happened is, during this war, Mao doesn't want to lose it. So he created a project called a secret military project. Though it is a secret, it is for the good of humanity. First time he did was something good. It is called a Project 523. It started in 1967. In May 2023, May, he started this project. He had around actually 523 scientists and doctors. He brought it back from the labor camps. He hired one of these women, Tu Yu. Her name is Tu Yu. He hired her to find a drug for the fighting malaria. She has no degree. She has no degree. She has no background in anything except she was she went to school in Chinese traditional medicine. Okay, she did not. She didn't. She went to Peking, Beijing University of School of Pharmacy. That's a traditional Chinese medicine. She never studied anything Western medicine. She never took a class, and totally immersed in the Chinese traditional medicine. She was. So Mao selected her to one of the scientists to fight against to find a drug for the malaria. So what she did was, she went through all the um, Chinese manuals of 2,000-year-old Chinese manuals. What she found out, there is a guy. His name is Ji Hong. Ji Hong he was born in 283 in that time. After 283 AD. So Ji Hong he's a pharmacologist. He's a doctor. He wrote a first book. He's a physician, Chinese physician. He's a philosopher. He wrote a children's book. He's all over. He's a true polymath. When I talk about polymaths, I mention his name. He's a writer. He did everything. He did quite a bit of work in a lot of these things. He wrote one. He wrote, what he found out is, he wrote a first book. In that book, he mentioned malaria. He didn't mention as a malaria as a disease, intermittent fevers that he talked about it. That is a malaria symptoms. So he mentioned in that book, in the traditional Chinese, he wrote a first aid kit people can carry with them. Is called, that I don't know how to do Chinese name on it, but it's a first emergency book, first aid kit. He did that, so you can carry with you the book and you can find the solutions if there is a small problems. So he is the first in the 280 200 300, beginning of 300. He did write that book. So it is a very popular guy. He's very popular. He's a military. He's a Nobel in the community. He's a commander in the area, like a governor. His family is very politically connected. So what he did was, he was using the traditional Chinese medicines are, as you know, acupuncture and Tai Chi and herbal medicines. They're all these use. These are the 2,000-year-old traditional Chinese medicine. What he did was, there is a Xinghua, sweet wormwood. He was giving this wormwood. This is a water from the wormwood, given to the patients as a treatment for malaria, as a treatment for the intermittent fevers. It is solving the problem. So a lot of people, that was she Chinese traditional Chinese doctors know about it, but what they misinterpreted, even Chinese people, misunderstanding of Chinese language, the way it is misinterpreted in a way that is, what they're doing is, they took his Xinghua, the wormwood, the sweet wormwood, is basically scrubs. It grows all over China, in fact. So they take the scrubs and then putting in the hot tea and giving to them, it is not working. So all the new scientists tried that. They could not find the treatment for malaria the way the Ji Young was treating. Then she, to Yu, the lady that was hired by Mao, she read it very clearly. There was a something misinterpretation she found out. What the misinterpretation was, he said that don't put in hot water, hot boiled water. She said that warm water you put in the whole day and you extract that water that you do. That's what she did. She found out the way to extract that compound, that is to give it to the patients. That is what she thought it is worked. That is exactly what Ji Young mentioned in this one. He didn't say put in hot tea. So that was a remarkable discovery. Then what she did was, after that, she extracted a compound called artemisinin compound. That is the treatment for malaria. Is a gold treatment right now, gold standard actually. Clinical trials went in successful 1972. Blockbuster drug. Artemisinin is a blockbuster. It did work. The compound is the molecule is works beautiful. And then she was immediately, she was well recognized because of that. Artemisinin is the so North Vietnam one. So they supplied these artemisinin, the Xinhua, the scrubs to the North Vietnamese soldiers. They were not failing sick, and Southern Vietnamese soldiers were getting sick and sicker. And then eventually, the fall of Saigon happened. The famous picture, that everybody knows this famous picture. The last people coming out of the Saigon from a United States embassy. You know, so that's South Vietnam lost the war because of this. Malaria played a very critical role, and malaria drug played a critical role in this process. So artemisinin compound, then they take a Novartis, they license it to Novartis. Novartis took it and then mass produced this thing. Is a blockbuster drug, sold as a combo drug. They gave it to them. Artemisinin is a type of the traditional Chinese medicine. Western people never believed in it. The first time they thought about the traditional Chinese medicine, which is the artemisinin compound, came out of the shengguo, scrubs from the Chinese grass. That basically it is a treatment for the malaria at the time. Even now, that is the combo drug. They use artemisinin compound. So Novartis made lots of money. The malaria drug they supplied to a lot of people. So she won the Nobel Prize. They declared first woman without any scientific, Western scientific, no scientific background. They said that it's a very, first woman to win in the China. First woman. There is no other woman before that won the Nobel Prize in scientific community. So she was a head of the she was came on the Time magazine. She won the Laskar Award. The DeBakey Laskar is from Houston. DeBakey Award. She won the DeBakey Award, and she became very popular because 2UU is extreme. They became the really saved millions of people through this artemisinin drug. They gave it to China. The secret project of the 523, the stopped at 1982, stopped 1976. Mao died, and then after 6 years after that, the secret project died. They closed it. But the 2UU paid a tribute to Ji Hong, and saying that because of him, traditional Chinese medicine really gave her this kind of thing, insights into that. Clinical trials. They've been doing thousands of years clinical trials, so they know what works, what doesn't work. So Dr. Kornfeld is talking about ancestral diet, ancestral medicines. These are all. So she was a remarkable woman. So she's a three without. They called her in Chinese traditional. The Western trained Chinese doctors did not like her so much, because she got the Nobel Prize. They didn't get it. So it's kind of there's a jealousy factor there a little bit. But the woman without a degree, there is no degree for her. There is without any publishing a paper, and without any. She's not a part of the Communist Party or Academy of Sciences, and she became a chief scientist for the now still even today she is the chief scientist for the China Academy of Medical Sciences. She's still alive. Let me tell you, 93 years old woman, she's still alive. She is true legend in my view, saving millions of lives with automation compound, still saving lives. So she is one of the in my view, she is a true hero and saving millions of lives. And then she automatically then she said she's a truly living legend, 93 years old, excellent health, and her house is declared as a public the Chinese history part of the history of the Chinese museum now. Her house the place she was born is a became a Chinese historical place now. So she said that that's what she said. Science should always be driven by compassion and the desire to elevate suffering. That is the bottom line. That's what Dr. Robert Kornfeld is talking about. He's not selling the drugs, not selling everything, just to elevate suffering and then help people with the compassion. That is the she did this message for around the world and still living. Sham, I actually I could not able to produce a t-shirts, but I did you can buy G Hong t-shirts. I did. G Hong shirts are available on my Amazon store. You can buy. But let me bring Dr. Cornfield back to stage and let me ask him what he thinks of it. Let me.
So, I mean, obviously, what this shows us is the power inherent in nature. There's so many things that nature provides us that are helpful to our quality of life. And it depends on the pioneers to figure it out. And, it's interesting because you kept bringing up that she had no degrees. I can tell you firsthand that although I obviously have my degree, my patients don't really care about my certifications. They don't care all the courses I've taken. They're not interested in anything other than, am I listening to them and am I helping them? And, when we key into a patient's needs and we really understand where they're coming from, we have a better opportunity to help them. So, what I find really interesting, at least in my lifetime, is that when someone comes along and they are a pioneer, there's always a backlash to the pioneer. There are always people that come and try to detract from what's happening and try to sabotage what's happening. And yet, in spite of it, pioneers figure things out and they improve the quality of life for everybody on the planet. So I might not consider myself a pioneer like Jihong, but in my field, I have been, because for the last 37 years that I've been practicing this way, I've been the only one in the country doing it. But fortunately now, there's more of a need for it. Patients are demanding it. I started a teaching institute a year ago to teach all of the other podiatrists that are interested in learning this how to practice this way so that we can better answer the needs of the public and do a better job of taking care of their health without drugging them and without overutilizing surgical procedures. But I found this very interesting. Thank you.
Yeah, well said. I agree. My father is a small time village doctor in India. He practiced, same thing he did. He was helping people and improving the health of immune system development. He was talking about all those things, eat right and then do right, yeah, those kind of things. The doctors now became a pharmaceutical, that's a problem right now that the public, even though doctors have a noble profession, they work very hard and they understand things. Unfortunately, they got this thing that they are representing the pharmaceutical companies rather than them. They need to be people like they should become like you to the true advocates for the patient's health. I think that is what we need. That we hope we want the doctors to be true advocates for the well-being of the patient and the well-being of the nation itself, overall health. So you're the true ambassadors for us because you understand the health. So you need to be raising voices. People like you need to raise voices, and you're one of them. Just unfortunately, there's a lot of reimbursement, the money structure, the revenue generation, and all those things are tied to these corporate structures. When really we are facing a huge crisis We need to solve this problem. Health is something that is a central point, not the how do you make profits or how do you. Health is not a commodity. It is a fundamental right in that sense.
I agree. And, one of the things that was blocking me from being the kind of doctor I want to be is how the system evolved into an insurance pay system. In America, we fell prey to this whole dynamic of health insurance. And it didn't take very long for insurance companies to catch on that they could pay us less and pocket more money. And the less they paid us, the more patients we had to see to stay solvent. And it evolved into a situation where so many people were piling into the office, you had to have quick fixes for people coming in. Like I spend an hour with a new patient now, sometimes an hour and a half. I used to spend 10 minutes because I had a huge volume of people to see. So what did I do in the early stages of my career? I thought, okay, I'm going to give this patient some pain relief with a prescription or an injection of cortisone. If that doesn't work, I'll take them to the operating room and I'll fix what's broken. But we left the underlying mechanisms unmanaged. And that patient, although maybe my surgery did help them, sooner or later something else was going to go. And I think, unfortunately, right now we're in a very bad situation because doctors are suffering the effects of this enormous burden of patient volume and charting and the demands put upon the practice. And there's a lot of burnout amongst physicians. There's a lot of stress. They're not at their best because they're going through these tough times. And I really think the system has to change. I walked away from the insurance world 24 years ago. I know I'm a much better doctor now because I'm not rushing through my day. I spend a lot of time with my patients. I make sure I know exactly what's going on so I can help them the best I possibly can. But I think there's a lot that has to change. And yes, prescriptions are overutilized because when people come in for a 3 or 4 or 5 minute visit, doctor has to do something to make them better. Prescriptions are the way to go for that situation, but are we really improving the health of the public? I don't know. Intervening on behalf of symptoms doesn't seem to me to be a health promoting way to practice. So I would love to see things change.
So let us talk about the concierge medicine that you're doing a direct podiatry. I come across quite a bit of doctors nowadays doing a direct care, direct
Mhm.
without any insurances. So how do you manage that? And are you happy with that, the model that you have now?
I'm absolutely thrilled with it. I have no stress. I
Okay.
have very deep doctor-patient bonds now because I can spend a lot of time with my patients. And, one of the things in medicine, it's not just the medicines we use, it's not just the surgical procedures, it's how we bond. When a patient trusts what we're doing, they're more compliant because they trust what we're recommending. A compliant patient is going to do much better than a patient who doesn't trust. And believe me, I hear it all the time. I treat mostly chronic foot and ankle pain, patients that have been to 5, 6, 10, 20 other doctors and are still in pain. And they all say to me, no one ever took this much time with me. No one ever listened to me like this. No one even gave me eye contact because their head is buried in the computer because they have to chart everything and make sure their notes are right because they're submitting this to insurance to hopefully get reimbursed so they can keep practicing. So I think that for me, it's been a wonderful experience. It's the best 24 years of my 42 years in practice. I just adore what I do. I love my patients. I love helping people because I'm really helping people the way I want to now with no interference from an insurance company because they now set the standard of care and they're not doctors. They're functioning from a financial algorithm. They don't care about the patient's health. They just want to keep as much of the premium dollars as they possibly can. So what better way to do that than to exploit the knowledge and expertise of doctors? So I hope things are going to change sooner than later. I know there is a movement more toward direct care than there ever was before. Certainly, when I started doing it, almost nobody was doing it. But I just couldn't take the dynamic of the insurance companies anymore. I was willing to leave medicine at that point.
Let us talk about a little bit about your music career. Tell me about the music
Okay.
that you love. You love music. You're a drummer.
Yes.
Let
So,
me ask you that. Yeah.
interestingly enough, because direct care, you're not working like a dog, I had time to be who I really am, all parts of me. And I have been a musician since I'm 10. So I started getting into writing songs and having them professionally produced. And that was a great joy for me because I didn't want to, I didn't think I had the time to be in a band at that point. But I was enjoying, the writing. I was enjoying the production part of it. I really loved what I was doing, but there was something inside of me that said, you got to go back into the band thing. So I started to get back into being in bands about 10 years ago. And about 5 years ago, I realized that my primary love in music is the blues. So I started a blues band, and it's just been such a joyful ride for me. We've recorded an album. We're now working on our second album. We play live shows. We're getting more popular, and we're starting to get asked to do more gigs. And it's just an absolute joy for me. The drums are a great way for my brain to get exercised because both your hands and both your feet are doing different things, and everything has to be coordinated. And it's just a lot of fun. It's a great instrument.
Thank you so much. I love blues. Send me next time you need to play drums for us in our place. That's
Okay.
thank you so much, Dr. Kornfeld. It's a really pleasure talking with you. It's
Thank you.
really, you educated a lot of new things for us. Thank you so much.
It's my pleasure. Thank you, Romano.
That's Dr. Kornfield, the ancestor advocate for the ancestral diet and a pioneer, immunology, immune system enhancement. Thank you so much. That is, thank you all. Good night, all of you. See you next week. The next month, I'm getting an excellent guest. See that Dr. Jonathan Fisher is going to be there, and I'm going to announce it. A lot of guests are coming up. Thank you all so much. Good night, all of you. One second.
Detailing their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it